Your body is doing something extraordinary right now and you have no idea it is happening. While you are watching this video, your immune cells are hunting pathogens, your neurons are firing signals across billions of connections, your heart is adjusting its rhythm based on signals it received before you even consciously registered them, and somewhere in your digestive system, a microscopic battle between chemistry and biology is playing out in real time. Most people go through their entire lives treating the human body like a car. You put fuel in, you drive it until something breaks, and then you take it to someone else to fix. But what if you actually understood what was happening under the hood? Because the truth is, the body sends warning signals constantly, and most of us have been trained, either by habit or by the culture of pushing through discomfort, to ignore every single one of them. Today on Health Insider MD, I want to take you on a journey through several systems of the human body that most people never think about until something goes badly wrong. We are going to talk about dental health and what actually happens when plaque and tartar are allowed to build up unchecked. We are going to get into the immune system and how it responds to viral and bacterial invaders in ways that are genuinely fascinating when you understand the mechanics. We are going to cover nicotine addiction and withdrawal, phantom limb pain, nasal congestion, the hidden warning signs of a heart attack that most people dismiss entirely, and we are going to end with something that almost nobody talks about openly but that has real health implications. This is a lot of ground to cover, but every topic connects to the same core truth. Your body is always communicating with you. The question is whether you are listening. Start with your mouth, because that is where a lot of systemic health problems actually begin, and almost nobody takes dental health as seriously as they should until they are sitting in the chair in genuine pain. Plaque is the soft, sticky film of bacteria that forms on your teeth continuously. If you brush and floss consistently, you disrupt it before it can mineralize. If you do not, it hardens into tartar, also called calculus, and once it hardens, no amount of brushing at home will remove it. You need a professional cleaning. The ultrasonic scaler that dental hygienists use works by vibrating at extremely high frequency, essentially shattering the tartar buildup off the tooth surface. It is not a comfortable experience, and one of the things patients frequently notice afterward is sensitivity. Cold water feels sharp, air feels uncomfortable, and the whole mouth feels raw and exposed. This is normal, and here is why it happens. The tartar had been covering the tooth surface, and specifically the area near the gum line where enamel is thinner or where some root surface may be exposed. Once that covering is removed, the underlying structure is suddenly in direct contact with temperature and sensation again. The sensitivity is temporary in the vast majority of cases. It resolves within a few days to a couple of weeks as the tissues adjust. Using a sensitivity-formulated toothpaste with potassium nitrate or stannous fluoride during that adjustment period helps significantly. What patients also notice after a professional cleaning is that their teeth look further apart or that gaps seem suddenly visible. Here is the reality. Those gaps were always there. They were packed with calculus, which gave the illusion of continuous solid tooth contact. The gum tissue had also likely been inflamed and swollen, which made everything look more crowded and compressed. Once the deposit is removed and the inflammation begins to resolve, the actual anatomy of your teeth and gums becomes visible. If those gaps look alarming to you, the right response is not to panic. It is to commit to the kind of daily interdental cleaning that prevents the space from refilling with plaque. Floss, interdental brushes, water flossers, something that actually cleans between the teeth where your brush never reaches. Wisdom teeth deserve their own conversation because the suffering associated with their removal is genuinely misunderstood by most patients going in. Third molars, the wisdom teeth, are the last to erupt, typically in the late teens or early 20s, and the modern human jaw often simply does not have adequate space for them. They come in at wrong angles, they push against neighboring teeth, they partially erupt and create pockets where bacteria accumulate that are impossible to clean. Impacted wisdom teeth, meaning teeth that are fully or partially trapped within the jawbone or gum tissue, require surgical extraction rather than a simple pull. The gum tissue needs to be incised and reflected. The bone around the tooth sometimes needs to be carefully removed. The tooth itself often needs to be sectioned into pieces because trying to remove it whole would require force and torque that could damage surrounding structures. This is why wisdom tooth extraction is actual surgery and why recovery takes days and not hours. Swelling, limited jaw opening, and soreness are expected. Most oral surgeons recommend extracting one side at a time for exactly the reason that eating and functioning on the other side remains possible during recovery. Now let's talk about something that sits at the intersection of immunology and everyday experience, because understanding how your immune system actually responds to infection changes how you interpret symptoms that most people find miserable and pointless. When a pathogen, whether bacterial or viral, enters your body, your innate immune system responds first. White blood cells called neutrophils and macrophages begin attacking the invader immediately, before your body has had time to build a targeted antibody response. Fever is one of the tools your immune system uses deliberately. The elevated body temperature creates an environment that is less hospitable to many pathogens while simultaneously accelerating the activity of immune cells. The misery of a fever is not a malfunction, it is your immune system running at capacity. The adaptive immune response, the one that generates specific antibodies and memory cells, takes several days to mobilize. This is the window during which a viral infection tends to feel worst. The virus is replicating rapidly, your innate immune response is fighting hard and generating inflammation in the process, and your targeted adaptive response has not yet arrived in force. This is also why antibiotics do nothing for viral infections. Antibiotics target bacterial cellular processes. Viruses are not bacteria, they are not even technically alive in the conventional sense. They are genetic material wrapped in protein, and they replicate by hijacking your own cells. Giving antibiotics for a cold or flu does not shorten the illness. It does contribute to antibiotic resistance, which is one of the most serious public health threats we face globally. Some viruses are particularly sophisticated at evading immune detection. They hide inside host cells, they mutate rapidly to avoid recognition, or they suppress immune signaling. Cancers use some of these same evasion tactics, which is part of what makes them so difficult to treat and part of what makes newer immunotherapy approaches so exciting from a medical perspective. Targeted cancer therapy, which uses drugs designed to identify and bind to specific molecular markers expressed by cancer cells, represents a significant departure from traditional chemotherapy, which essentially attacks all rapidly dividing cells in the body, healthy and malignant alike. If a cancer cell has a specific gene mutation or protein overexpression on its surface, targeted therapy can home in on that feature specifically. Patients who qualify for targeted therapy based on their tumor's molecular profile often experience fewer systemic side effects than patients on conventional chemotherapy, though it is not a universal option and not every cancer has an identifiable target. Radiation therapy works differently again. High-energy beams are directed at the tumor site to destroy cancer cell DNA and prevent replication. The challenge is that ionizing radiation cannot perfectly distinguish between cancerous and normal tissue, which is why radiation treatment comes with side effects in the region being treated. Modern radiation oncology has become extraordinarily precise, using techniques like stereotactic radiosurgery and intensity-modulated radiation therapy to concentrate the dose at the tumor while sparing surrounding tissue as much as physically possible. Normal cells also have better DNA repair mechanisms than cancer cells, which is why they recover from radiation damage more effectively. This is the reason radiation is delivered in fractions over multiple sessions rather than all at once. Giving normal tissue time to recover between doses is part of the treatment design, not an inconvenience. Nicotine addiction is worth spending real time on because the gap between how most people think quitting smoking works and how it actually works is enormous. Nicotine binds to acetylcholine receptors in the brain and causes a release of dopamine, which is the neurotransmitter associated with reward and pleasure. Over time, the brain compensates by downregulating its own natural dopamine signaling and growing more nicotine receptors, essentially recalibrating itself around the expectation of regular nicotine input. This is why withdrawal is so physically and psychologically uncomfortable. When nicotine is suddenly absent, the brain is running on a system that has been optimized for its presence. Irritability, anxiety, intense cravings, difficulty concentrating, restlessness, and mood disturbance are all predictable neurological consequences of the brain attempting to recalibrate without its habitual input. The weight gain that many people experience when quitting smoking is real and has a physiological basis. Nicotine increases metabolic rate and suppresses appetite. When nicotine is removed, metabolic rate drops somewhat and appetite increases. Eating also becomes a coping behavior that partially substitutes for the oral and behavioral ritual of smoking. This is not a character flaw, it is a predictable consequence of withdrawing a substance that had been modulating appetite and metabolism for years. Managing it requires awareness, intentional nutritional choices, and physical activity to help stabilize mood and metabolism through the withdrawal period. The nasal anatomy produces one of the most relatable but least understood phenomena in everyday physiology, which is the nasal cycle. Most people assume that when one nostril is congested, it is because of illness or allergy. In reality, your nasal passages alternate dominance roughly every 2 to 6 hours in a cyclically controlled pattern regulated by the autonomic nervous system. One side dilates while the other constricts, then they switch. You are usually only aware of this when total nasal airflow is already compromised by illness or structural issues, at which point the cycling feels like a taunting alternation between the two sides. Chronic rhinitis, whether allergic or non-allergic, is persistent inflammation of the nasal mucosa. It is not curable in the sense that you can eliminate the underlying tendency, but it is manageable through avoidance of triggers, nasal corticosteroid sprays, antihistamines, and in some structural cases, surgical intervention to improve airway patency. Phantom limb pain is one of the most extraordinary phenomena in all of clinical neuroscience, and it forces you to confront something deeply strange about consciousness and sensory experience. When a limb is amputated, the nerve pathways that used to carry sensation from that limb do not disappear. The brain map, which is a literal cortical representation of body surface that neuroscientists call the somatosensory homunculus, retains the region assigned to that limb. Without incoming signals from the actual limb, those neurons can become hyperactive and generate sensations spontaneously. The brain interprets these signals the only way it knows how, as sensation coming from the limb that is no longer there. Patients describe pain, pressure, itching, temperature, and movement in a limb that does not exist. This is not psychological. It is neurological, and it is one of the clearest demonstrations that your experience of your own body is a construction of your brain, not a direct readout of physical reality. Now, I want to talk about something that kills people not because medicine lacks the tools to save them, but because they do not recognize what is happening until it is too late. Atypical heart attack presentations are responsible for an enormous number of preventable deaths, and the reason they are missed is that they do not always look like what people expect. The classic cinematic heart attack, crushing left-sided chest pain radiating down the arm, does occur, but it is far from the only presentation. Referred pain from cardiac ischemia can manifest as jaw pain, toothache, throat tightness, upper abdominal discomfort, or nausea, particularly in women and diabetic patients who may have altered pain signaling due to autonomic neuropathy. The cardiac connection exists because the heart and some of these structures share nerve pathways, and the brain misattributes the source of the pain signal. If you experience unexplained jaw or tooth pain combined with nausea, unusual fatigue, sweating, or shortness of breath, especially if these symptoms come on suddenly and feel different from anything you have experienced before, this combination warrants emergency evaluation. Not a scheduled appointment for next week. Emergency evaluation. The heart muscle begins dying within minutes of a complete blockage of coronary blood flow. Every minute of delay between symptom onset and reperfusion is brain and heart tissue that cannot be recovered. The phrase time is muscle is not rhetorical in cardiology. It is literal. Finally, reproductive health deserves to be discussed plainly and without embarrassment because misinformation in this area has real consequences. Pre-ejaculatory fluid, commonly called pre-ejaculate, is produced by the Cowper's glands and is released before ejaculation. While its primary function is to lubricate the urethra and neutralize acidity, it can contain motile sperm, particularly if a man has ejaculated recently and sperm remain in the urethra. The concentration is lower than in ejaculatory fluid, but pregnancy is biologically possible from pre-ejaculate contact with a fertile partner. This is why relying on withdrawal as a sole contraceptive method carries meaningful failure rates. It is not that withdrawal is never practiced, it is that the biology does not cooperate as cleanly as the strategy assumes. Understanding these mechanisms is not about frightening anyone. It is about making genuinely informed decisions about health, because informed decisions are always better than assumptions built on incomplete information. What every topic we covered today has in common is that the body is not random. It follows rules, it sends signals, and it responds predictably to inputs. Dental neglect follows a predictable path to infection and systemic inflammation. Immune responses follow predictable patterns that explain why you feel the way you do when you are sick. Nicotine hijacks a predictable dopamine pathway, and withdrawal follows a predictable neurological arc. Heart attacks follow predictable patterns of referred pain that are recognizable if you know what to look for. The body is not mysterious,